Hello there and welcome to Health Matters, a presentation by the Ministry of Health. I am Nazim Hussain. Welcome to the program. This year, World AIDS Day, we'll be talking about World AIDS Day and HIV and AIDS, is on December 1, 2024, with the theme Taking the Right Path. And I have a number of guests with us today. I'll start with Dr. Tariq Jagnarine. He is the program manager of the National AIDS Program Secretariat. Dr. Jagnarine, welcome to our program. It's been a year with the National AIDS Program, and I'm quite sure lots of work, lots of achievement. Can you give us a highlight as to what were the main focus for the National AIDS Program for 2024 achievements, and how would you want to see it as it relates to taking the right path?
So first and foremost, thank you for having me here, Nazim. So as you said, World AIDS Day this year is celebrated under the theme Taking the Right Path, and it's quite an apt theme. In fact, most of the work we've done for 2024 is streamlined around that theme. Some of the new things that we focused on was trying to take service to communities and to ensure that persons, the service they receive, it's patient-centered. So we do what you call a lot of differentiated service delivery, which include things like going to find where a lot of men are present, ensuring they receive testing, ensuring they receive condoms, lubricants, PrEP. Men are a group of persons who have a tendency to have a hesitancy to visit health centers, and so we try to find avenues to meet them. We go to schools, talk to the youths about safe sexual practices, talk to them about diversity, human rights, SOGI. We've been having a lot of testing in the afternoons, going to key spots where we can find key population, sex workers, whether it's men or women, finding even persons who belong to various vulnerable groups, barbershops, brotels, salons, bars, and ensure that we can offer testing, and not just testing, but offer comprehensive service, giving them condoms with PrEP. We even have a few of the facilities that we offer HIV testing. They offer extended hours testing instead of wrapping up at 4:30. Many of them have gone beyond 6:30 to even 8 o'clock. Besides that, we've actually streamlined ourselves in ensuring that a large number of persons can have access to PrEP. Not just access, but to know what is PrEP. Guyana, I'm happy to say we've had almost a good year with distribution of PrEP and getting people on PrEP. Almost 30,000 plus persons would have received PrEP for 2024. And then we had a regular refill, somewhere around 6,000 persons who are regularly refilling their PrEP. Self-testing has also been a good initiative of us, a huge uptake. We've actually started many different approaches so we can get self-testing to person out there, including the home delivery of self-testing kits, which is continuous. It's done in Central Georgetown, where you just call us. We give you counseling online. We tell you how to use the kit. We ensure that we let you know it's a preliminary test. And then we deliver the kits to persons, and that has been successful. You're familiar with our famous PrEP for Sex kit that we share out there. Some persons will refer to it as the lash bag. That has been a huge success. We've distributed more than 3,000 of those to various spots, and that has continued to go on. Treatment, we have for the past few years, we've had difficulty in accessing persons when it comes to treatment. And this year, we've moved our cohort from that of 6,000 to almost 7,400 persons, and which is very good. We're going out there, we're finding people, we're bringing them back to clinic. And not only bringing them back, linking them to quality treatment. Free, but treatment now that is highly effective, giving them good results and bringing down their viral load. And then there's also, speaking about that viral load, we've now ensured that we've given good viral load to persons out there. So a lot has been happening. I mean, a lot more can continue to happen. And one of the biggest areas we got to continue working on is campaigning and getting messaging out there.
Doctor, I wanted to just almost, as we approach the end of the year, there was a report from the UN, and it's talked about our spike in infection with young people. Can we talk about that and what is the particular system in place? You did say that you were going into school, but I mean, those numbers really, touched you in any way?
So definitely what happened with that report, there was some erroneous information with it. The report said that there was a spike in youths who are having HIV in the Caribbean. But what it did not show is that Guyana and Suriname happen to be the lowest when it comes to the youths. And so, of course, youth is a vulnerable group. We have to keep working with them, and we recognize that as a priority area, and we've been working with the youths. And ideally, if we have to, like the World AIDS Day team speaks about taking the right spot, we need to ensure that everybody plays their part and we can reach everyone. This is not just, HIV is not just a one-man show and a special group of people are affected. Everyone is involved. And so one of the first things we've been trying to ensure is that there's persons out there are well informed. You're informed that even the basic ways of transmitting HIV, nobody gets it from shaking your hand or hugging you. And so we try to teach people, we're not just the youths, we go to workplaces, we go to where we can find any place of large gatherings so we can teach people. We go to bars, brothels. We also want to ensure that persons out there, they use condom effectively, they use PrEP. We want to ensure that people out there know that there's quality care and service that are available at our treatment centers. And there's so many we've been expanding, and that's something I
Well,
forgot
yeah,
to
talk about
mention.
expansion. Yes.
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 We've been moving away from getting the regular care and treatment sites and ensuring that we can take treatment for persons living with HIV to all primary health care facilities. And we've had huge successes in many of the regions where we've trained all of the clinicians, the healthcare workers, to provide HIV treatment and care services. So anyone who shows up, it's no longer that you have to wait for a special day or a special clinic. You can show up at a regular health center and receive your treatment. And a lot has to do with the fact that the face of HIV has changed somewhat, the dynamics. Persons are no longer dying with HIV, they're living longer. And so once you're living longer, there's the issue that comes that you need to talk about, which is HIV and aging. The persons are presented with many comorbid disease, hypertension, diabetes, cardiovascular problem, renal problems. Some of these things are related back to HIV as a consequence. And so we've been preparing them to be integrated in the primary health care where they can have that optimal care, that holistic approach. And it has been success. We've done region 1, regions 3, region 6, region 4 there. We've done most of the sites. We've got to continue expanding in few of the sites. We try to ensure we go to sites where persons cannot just see a clinician and get their treatment, but also there's social workers that can provide counseling and guide them with whatever social issues they have. Because that's what taking the right path involves. Ensuring that we can care from a holistic approach for individuals and ensure there's an environment that is free of stigma, free of discrimination.
And then there's some degree of support mechanism also built in. We'll talk about that.
Definitely, because what we try to ensure is that when we take you to a site, you can get support because you can get public assistance for persons who are not employed or may have some sort of difficulty at that specific moment. We provide a public assistance for them. There is a food hamper service that we can offer to persons until they get on their feet. There's a voucher system. Voucher not just for food items, there's also the cervical cancer, eye screening. So that comprehensive care is what we try to give to individuals when they show up. We try to make their treatment regimens suited to them in a sense. Like if you show up and you can't come every two months or every 3 months, we give you multi-month drug dispensing. If you're okay with a family member picking up your drugs, we try to accommodate that. So we try to ensure that persons living with HIV, they don't see it as a burdensome reason to show up at the health center. That when they show up, they're well cared for.
The theme this year, taking the right path. How does the NAPS really ensure that the human rights of persons living with HIV and AIDS is protected?
So that's one of our paramount and priority areas that we've been focusing on, not just recently. Our National Strategic Plan, HIV Vision 2025, has a whole section that speaks on human rights. And so we've been going to places and speaking about human rights issues, speaking about stigma, speaking about discrimination to many workplaces, working with the Guyana Police Force, the Guyana Defense Force, working with men, working with youths, working with workplaces. And this is something that's ongoing, it's continuing, and we'll continue to do it. And to champion that at the end of the day, if you want to end HIV, the social issues like that of human rights needs to be addressed.
Okay. Just as we wrap up your segment of the program, anything you would need to mention as we observe World AIDS Day?
So there's a lot that is happening for World AIDS Day. We're going to communities and ensuring that the service we offer All of that we take to communities. Look out for us. Please like and follow our Facebook page. You'll see what's happening. And if you have suggestions, message us. Let us know what differently we can do. We want persons to start using PrEP. If you don't know about PrEP, reach out to us. Ask us what is PrEP. Self-testing kits. If you need that, call us. Let us know. We want to ensure that you can get access to self-testing kit. Remember, if we need to end HIV and have good control of the situation for HIV, all of us need to play our part.
Thank you, Dr. Jagnarine. We'll find out more about PrEP and self-testing when we come back. This is Health Matters.
Preventing HIV and having safe and healthy relationships are an important part of sexual health. We'll take you through an overview of PrEP with PrEP 101, show you how to access PrEP, and let you find out if PrEP is right for you. PrEP is an HIV prevention option that works by taking one pill every day. PrEP stands for Pre-Exposure Prophylaxis. When taken every day, PrEP can provide a high level of protection against HIV and is even more effective when it is combined with condoms and other prevention tools. People who use PrEP should take the medicine every day and return to their healthcare provider every 3 months for follow-up and prescription refills. Now, some people in clinical studies of PrEP had early side effects such as upset stomach, loss of appetite, or mild headache. How do you start PrEP? Talk with your doctor or healthcare provider. If you and your provider agree that PrEP might help, get tested for HIV and other sexually transmitted diseases, and to see if your kidneys are working well. If PrEP is a good option for you, your provider will give you a prescription.
Welcome back to our program. Dr. Kiesha Chin, she's the STI coordinator at the National AIDS Program Secretariat and has a humongous task to talk, as we were talking about with Dr. Jagnarine, with PrEP and NPEP and self-testing kits. That's Dr. Chin's responsibility. Dr. Chin, welcome to the program. Tall order, but give us more details, especially for those who might not know PrEP.
Okay, first, thanks for having me here. So, on reflecting on this year's observance of World AIDS Day, focusing on the theme for this year's celebration, which is Take the Right Spot, it really gives us an idea or a mandate that what we should place emphasis on is on the rights of persons that are not only living with HIV, but also to remember those that are affected by the disease as well. Now, in focusing on the rights of those persons, it really tells us that what we should do is empower those persons with the tools necessary to not to protect themselves against HIV and other forms of sexually transmitted infections. Now, I want to make mention of 2 specific tools that we are looking to make more available and accessible to the general public as part of the empowerment of persons that are affected by HIV or most vulnerable, as we would like to say. Now, the first of those 2 tools, I would like to talk about PrEP, which stands for Pre-Exposure Prophylaxis for HIV Prevention. We would have heard, or a lot of us are already familiar, that PrEP is a medication given to persons prior to them being potentially exposed to HIV, and it's really meant for persons who are at substantial risk for HIV contraction. And it allows them to, prior to being exposed, be protected against the virus. And really, in focusing on the rights of persons that are at substantial risk for HIV, we want to ensure that that particular product is more accessible and more available to not only persons of the general population, but also persons that we consider key populations and persons from vulnerable groups. For far too long, persons from marginalized groups and communities are not aware of health services and health products that we have. So we are really making an effort at the National AIDS Program Secretariat, in keeping with the theme for this year's World AIDS Day, to go into those communities, bring awareness and sensitization, allow persons to know what services we're offering, what products we have offered at the National AIDS Program Secretariat. Now, it's really an advancement in terms of science that we now have available an actual medication or a form of medication that prevents you from contracting HIV. But that's not all that we have available, which brings me to my second point, which is NPEP, which is for non-occupational post-exposure prophylaxis. Now, unlike the PrEP medication, which a person has to take prior to them being exposed to HIV, NPEP, they actually take after they would have potentially been exposed. But there is a short window in which you must start the medication, which is it within 72 hours or 3 days of the exposure. And it really acts as a safety net for persons that may have had potential exposure. So we also want to make that service more accessible and more available to, as I said, not only persons from the general population, but persons from key populations, vulnerable groups, marginalized communities, communities that are probably from low to middle income status, etc., where we really find persons that are in need of the services that we're offering.
Does that mean that we've gotten rid of the condoms?
No, we're not. We haven't actually. Now, it's an additional layer of protection. We are still advocating and making persons aware of condom use and the importance of condom use. As I said, PrEP and NPEP medications are additional layers to offer protection for persons that are looking to prevent contracting HIV. But PrEP and NPEP medication, they only protect you against HIV. We still have to be cognizant of all the other forms of sexually transmitted infections. And I love to repeat that there's no controlling or preventing HIV if you do not also address and mitigate the other forms of sexually transmitted infections. So definitely we're not doing away with condoms. We even have a variety of condoms that are going to be now available through the National AIDS Program Secretariat, available at a lot of our community health centers. While we have community outreaches, our health fairs, etc., they're flavored. We have chocolate flavored, strawberry flavored. They come in a variety of colors as well. So there's really something for everyone in terms of condoms as a commodity.
Walk us through as to how someone can access the PrEP, especially the PrEP.
Okay, so you can access PrEP at a lot of your community health centers. Now, we would have had throughout this year, starting from last year actually, and it continued throughout this year, we would have had integration of HIV services into primary health care. And basically what our integration talks about is that we try to move away a bit or navigate away from having HIV services, whether it's prevention specifically, only being offered at HIV care and treatment sites, meaning a particular health facility that has been designated to provide treatment for someone who's living with HIV. You can still go to the care and treatment sites, but there are lots of health facilities in various regions that are your routine community health centers that you can go and access the PrEP service. It remains free of cost. The consultations that you also receive, whether it's with a doctor, a medics, or any other category of healthcare worker, those services remain free. So we have it available at the community health centers. A few of our secondary level health facilities, like for example, the district hospitals, also have PrEP and NPEP services available. And as we would have mentioned a bit earlier, we also try to take the services to persons within the community. So we have a lot of mobile outreaches and community outreaches and health fairs within the community that we have PrEP services available. So the path that you normally take is to have an HIV test done, and once it's confirmed to be HIV negative, we can issue with the PrEP and PEP services as well.
Let's talk a bit about testing. But I know we spoke to Dr. Jagnarine about the self-testing. But before we talk about self-testing, what about the regular testing and counseling? Tell us a bit about that. Is that still available? Is it right across the country?
So we do try to have differentiated services. So while we're offering or in the process of offering new differentiated services,
and both for HIV and other STIs.
Correct. We haven't shied away from all the other services that we were previously offering. So definitely the rapid testing for HIV and other forms of sexually transmitted infections. For example, syphilis, hepatitis B, hepatitis C, and even routine screening for genital discharge syndromes like gonorrhea, chlamydia, etc. We are still continuing to offer those screening and testing services. And you can have it whether it's at a testing facility or on a lot of our mobile outreaches that we're doing within the various communities.
Testing has been out, but Listening to certain people on the ground and social media, we learn certain about it. Tell us a bit more.
So the self-testing, it's part of our differentiated services. Persons that opt not to have a routine blood drawn or rapid testing kit for HIV, they can have the self-testing, and it's referred to as our oral quick self-testing kit. So basically what a person can do, they can have it in, or they can test themselves in two modalities. A person can have a facility assisted test or a professional assisted test, in which they can visit a health facility. They can opt to use the oral HIV self-testing kit, and a professional or a counselor tester at the facility can assist them in having the sample, the oral sample taken, basically it's the saliva that we're using, and they can have the test done assisted and guided by a professional. Or they can opt the other modalities, that they can opt to simply receive the kit. We generate a code for them, which is exactly what we have been doing for a blood drawn kit. We ask for contact information, and we also allow them to go home with the self-testing kit, having received all the information necessary of how to properly and effectively use the HIV self-testing kit. Now, the thing that I want to address with the HIV self-testing kit is that there is no one in Guyana that is diagnosed to be HIV positive with one single test. We have a testing algorithm. So there's a high level of efficacy for the HIV self-testing kit. It's very sensitive, and it's also very, very specific for the HIV in terms of it being a virus. So if a person tests negative with an HIV self-testing kit, there's no need to go to a facility to then confirm the negative result. However, if you do have a reactive, we don't say positive, if you do have a reactive HIV self-testing kit, the advice is that you should go with your test kit to visit a health facility for them to then do a confirmatory test to see whether or not you are going to be diagnosed with HIV. If there is a discrepancy, and a discrepancy doesn't mean that there's something wrong with the kit, but you do have very rare instances in which a person would have a first test positive, a second test says negative, and then we go on to our tiebreaker, and whatever the tiebreaker shows, whether it's negative or positive, that will be your final result.
And these tests are available like the PrEP all across the country?
Correct. And persons can even visit the National AIDS Program Secretariat to uplift a free test kit as well.
Dr. Chin, thanks for being on our program today. When we come back, we'll find out what's happening for World AIDS Day with the National AIDS Program Secretariat. Don't go away.
In every relationship, communication is key. But what about those conversations we're afraid to have? Talking about sexual health with your partner can feel daunting. But with empathy, honesty, and support, it can strengthen your bond. Start the conversation today. A message from the National AIDS Program Secretariat-NAPS.
Welcome back to our final segment. I've got Kerry-Ann Patrick. She is a prevention coordinator attached to the National AIDS Program Secretariat. Kerry, lots of things happening as we lead up to World AIDS Day and beyond December. Tell us what's going to be happening.
Thank you for having me here, Mr. Nazim. Yes, we do have a packed calendar of activities in observance of World AIDS Day 2024. We have, as Dr. Jagnarine would have stated, we have several test outreaches and PrEP outreaches across Guyana. Just to name a few, we have in Port Kaituma, we have several in Region 3, we have in Tushin, Parfait, Bagotville. We also have outreaches in Georgetown. We will be at the Demico Car Park. We will be at the Seawall KK gas station. We also have outreaches in Madi and Lethem. We would advise persons to visit our NAPS Facebook page. We will keep you updated on all the upcoming activities. In addition to these testing outreaches, we also have school visits. As we know, the theme for World AIDS Day 2024 is Take Rights Path. One of the major agendas coming up with Take Rights Path is sensitization. The more persons know about HIV, the less discrimination we will have. So we're working very hard to get information out there on HIV and STI. In addition to these testing outreaches, we have several sensitization sessions with workplaces. We are currently visiting different banks. We have GBTI, we have Scotiabank, we're visiting offices, Massey, we have a schedule for Exxon Mobil. In addition to all these outreaches, we are also visiting healthcare facilities. We are not only dealing with the general public when we deal with Take the Rights Path, but we also need to start at the health facilities. So we have different stigma and discrimination sessions at our health centers across the country. We also have human rights workshops. We have them with Ministry of Tourism, and we also have them in the various regions 3, 6, and 10. In addition to these activities, one of the most anticipated activity for us is our video competition. So we have a video competition. The deadline is the 29th of November, where the general public will be creating videos and sending it to the National AIDS Program Secretariat. So the videos can be based on HIV, STI screening, condom use, PrEP, ARV treatment. We have zero discrimination and you equal you. All this information can be found on our Facebook page. We also have a NAPS trivia where we will be asking questions based on HIV and AIDS. You can call into the program and we will be giving away credit once you get the answer correct. One of our signature activities we will be having is a continuous credit conference on HIV and AIDS for our healthcare workers. This will be done on the 30th of November at the Police Training Center. At this conference, we will also be offering medical services to our healthcare workers. We will also have a day for joint service testing, whereby members of the joint service will be given HIV and STI screening. We also have the Flame and the Ribbon, which is a activity celebrated every year for World AIDS Day. That will be on the 1st of December at the National AIDS Program Secretariat. And our last activity for World AIDS Day, which will be on World AIDS Day, will be our walk. Every year we have a walk in collaboration with GRPA. For this year, that walk will be in Region 3. The assembly point will be at the Lenora Fire Station at 4 o'clock. So we're asking everybody to come out in observance of World AIDS Day 2024.
Kerry, thanks a lot for being on our program. Good luck to you and your team at the National AIDS Program. And so that brings us to an end of Health Matters. On this edition, we'll be talking with the hardworking folks at the National AIDS Program Secretariat as they're about to observe World AIDS Day with the theme Taking the Rights Path. I'm Nazim Hussain, wishing you all the best. Bye-bye and stay safe.